So the uterus is made of smooth muscle tissue, and uterine fibroids are an overgrowth of that muscle tissue in different locations in the uterus.
The uterus is actually a smooth muscle organ, and uterine fibroids are portions of this smooth muscle organized in a ball. There are various reasons why uterine fibroids develop. First of all, they can be genetic. So if your mother or your grandmother had it, there's a greater chance that you may develop fibroids. Secondly, anything that increases the amount of estrogens in your body can help fibroids grow, such as pregnancy. Other things that can contribute to it are ethnicity. Patients who are African American or from Hispanic backgrounds have a higher likelihood of having fibroids.
The size of fibroids matter in the symptoms that people may feel. The smaller fibroids generally are asymptomatic. However, some of them can cause significant increase in bleeding and even in pain, depending on the location of the fibroid.
So small fibroids can cause some problems and minimal problems, but as they can grow downward and compress your bladder, and you can have urinary frequency. They can grow towards the back and cause constipation. They can grow up and compress blood vessels or your kidneys, and if they grow out or anterior, they can actually push your abdominal wall musculature out and make you feel or look like you're pregnant. The location of the fibroid actually determines what your predominant symptoms are. So if the fibroid is close to the inner lining of the uterus or where a baby grows, you're probably going to have a lot of bleeding problems. As the fibroid is located more towards the outer lining of the uterus, then you tend to have more bulk symptoms or compression of adjacent structures. So the location actually determines not only what symptoms you're having, but also what treatment options are available to you.
Some of the less common symptoms or complaints that I hear are anemia, and that's generally caused from some of the more common symptoms of fibroids, heavy bleeding or intermittent bleeding throughout the cycle. The anemia can be important because it can cause significant fatigue as well as moodiness in patients, which clearly can affect their life. Some of the other symptoms of fibroids that are, again, less common but although very important would be infertility, difficulty in carrying a pregnancy, number 1 to term, so having some preterm labor is an issue, as well as even just miscarrying early on because of fibroids in the uterus.